Hi friends, welcome back to Complete Medical Coding, a complete CPC learning channel. Today, let's discuss few guidelines of 60,000 series. 60,000 series includes endocrine, nervous system, eye and ocular, and auditory system. Let's look each and every one. First, let's go to the endocrine system. Endocrine system series ranges from 60,000 to 60699. Few medical terminologies. What is thyroid lobectomy? The thyroid is exposed via a transverse cervical incision. What is thyroidectomy? Thyroidectomy means removal of thyroid. It can be partial or complete. For bilateral thyroidectomy, we need to use the modifier 50, which is the code for bilateral. Now, what is code 60512? It's an add-on code for parathyroid autotransplantation and cannot be reported separately. And for using laparoscopic adrenalectomy, you need to use the code 60650. Laparoscopic adrenalectomy. An adrenal gland is dissected and removed under laparoscopic guidance. The code will be 60650. Next, let's move on to nervous system. The series of nervous system is from 61000 to 64999. For surgery of a skull base, there are three important procedures: approach, definitive, repair and reconstruction. For approach procedure, it can be an anterior, middle or posterior. Then definitive procedure and then repair or reconstruction. So for surgery of a skull base, you need to look for these three procedures. If the code includes or if the procedure includes all these three procedures, then you need to code it accordingly. Now another important term in nervous system is twist drill and burr hole. Another name for burr hole is trephine. The code for twist drill and burr hole or trephine ranges from 61105 to 61253. If burr hole is followed by a craniotomy at the same operative session, we do not use 61250 or 61253 because the range is still 61253. But if it is followed by a craniotomy, we will not use the code, this range code, because it's already included in the craniotomy burr hole procedure. Now, intracranial arteries are divided into three vascular territories: right carotid circulation, left carotid circulation, and vertebrobasilar circulation. You need to check which vascular territory is being done in the procedure. Now, code 61645, it's a code for thrombectomy. It can be reported once for each intracranial vascular territory created. It will be reported only once, okay? Do not report 61645 in conjunction with 61650. What is 61650? Endovascular therapy. It's a code related to endovascular therapy, or 61651 for the same vascular distribution. All this you will understand while doing some practice questions. Next, let's move on to eye and ocular adnexa. The series ranges from 65091 to 68899. Few medical terminologies. Trichiasis. Trichiasis means it's an eye condition in which eyelashes grow in a wrong way towards the eye. Then, difference between entropion and ectropion. That's also an important question. Entropion, condition in which eyelid turns inward. Whereas ectropion means lower eyelid droops away from the eye and turns outwards. We have already discussed about these medical terminologies in the anatomical session. Now, strabismus surgery. Strabismus surgery means it's sewing the eye muscle to the outer covering of the eye after altering the insertion position and the length of the muscle. Now, code for strabismus surgery. Strabismus surgery can be the code ranges from 67311 to 67316, and it can be either for vertical muscles or horizontal muscles. So strabismus surgery done for horizontal muscles will be, codes will be 67311 and 312. And for the vertical muscles, it will be 67314 and 67316. Now, what's the code for cataract removal? 66982. This is the code that we will use for the cataract removal. Intravitreal drug delivery system. What do you mean by intravitreal drug delivery system? It's a kind of drug delivery system that releases medication into the vitreous humor. We have learned about aqueous humor and vitreous humor, right, in the eye. Vitreous humor is the gel-like substance. So, it's a system that releases medication into the vitreous, is then implanted into the vitreous humor by pars plana incision. Pars plana incision is an incision procedure. And the CPT code will be 67027. Now, what's the code for correction of trichiasis? Correction of trichiasis code is 67820. What do you mean by tassorrhaphy? That's also another important medical terminology. Tassorrhaphy means temporary closure of eyelids by suture. Code will be 67875. Now let's move on to auditory system, the auditory canal. Code ranges from 69000 to 69979. In this auditory system, one main important code will be, like procedure will be, removal of impacted cerumen, the removal of wax removal. It can be done in two ways, either instrumentation or through irrigation or lavage. If it is done through irrigation, you need to use the code 69209. If it is done through instrumentation, you need to use for 69210. Now, do not report 69209 along with 69210 when performed on the same ear. If it is on the same ear, we cannot use both the codes together. Either one have to be used. Now, tympanoplasty. Tympanoplasty is a graft that is used to repair the tympanic membrane perforation. And the code ranges from 69635 to 69646. Now, another important one, operating microscope. The use of an operating microscope during a surgical procedure. It's an add-on code. So, the add-on code for operating microscope is 69990. But we need to always check if the procedure code, if the CPT code already contains an operating microscope. If it already contains an operating microscope, then we do not code this operating microscope add-on code. We will not code it separately. 69990, we will not add it. We will not code it separately if it is already included in the CPT code. Okay. Now, apart from that, there are few more exceptions that are listed under this code. If you can go to the CPT code book, you will identify it 69990. If you will take the code 69990, there are a lot of procedures which are already comes under exceptions. So in that cases also we will not use this code. Now let's move on to some practice questions. Few these practice questions are just for a knowledge. We will do more practice questions in the upcoming sessions. So this one, first question, a 57-year-old woman presented with a diagnosis as secondary hypertension, malignant, renovascular, unprovoked hypokalemia, primary hyperaldosteronism. Surgeon performed a bilateral adrenalectomy with excision of adenoma by laparoscopic approach. What will be the procedure code? So, what is the surgeon performed? This woman is having lot of diagnosis like hypertension, malignant, hypokalemia, hypoaldosteronism, everything is there. But the procedure that surgeon is performing now is adrenalectomy with excision of adenoma by laparoscopic approach. What will be the procedure code? Okay. So you need to go to the index page and take adrenalectomy procedure. Adrenalectomy, laparoscopic adrenalectomy. So you will reach the code 60650. I'll just show you that in the CPT code book. See, if you can see the code 60650 in the CPT book, it's mentioned laparoscopy surgical with adrenalectomy, partial or complete, or exploration of adrenal gland with or without biopsy, transabdominal, lumbar or dorsal. So here the question is clearly mentioned laparoscopic adrenalectomy. So you need to use this code, and also surgeon has performed a bilateral adrenalectomy. So you need to append it with the modifier 50. Now second question, excision of carotid body tumor along with excision of carotid artery. What will be the code? So we need to take the carotid excision of carotid artery code from the index page. So let's take that code. I'll show you in the CPT book. See, in this procedure, in this code you can see 60600 excision of carotid body tumor without excision of carotid artery. But in our question it's mentioned with carotid, with the excision of carotid artery. So the code will be 60605. Now third question, using an operating microscope, the physician performs a neuroplasty of the right ring finger. What will be the code? So you need to take the neuroplasty code from the index page. Let's look into that. See, in this neuroplasty procedure, 64702, it represents digital, one or both same digit. 64704 represents nerve of foot or hand. No, we need the digit only, right? Because it's the physician performs neuroplasty of right ring finger. So it's a digit. So the code will be 64702. But this is done using an operating microscope. So the code will be, you need to add the operating microscope code, add-on code. So answer will be 64702 and 69990. Next question, code for vagus nerve block. That's a direct question. If you will see the procedure, if you can get the vagus nerve block from index page, you will directly get this question 644, get this answer 64408. I'll show you that. See, vagus nerve 64408. Vagus nerve injection aesthetic agent vagus nerve. So that will be the code for vagus nerve block 64408. Next question, ectropion repair using thermocauterization. What will be the code? So go to ectropion. Go to the code for ectropion. So if you will take ectropion from index page, you will reach 67914. That is repair of ectropion suture. If the question is related to suture, you need to use that. But here it's done through thermocauterization. So the code will be 67915. One more question. What is the CPT code for cochlear device implantation with mastoidectomy? So just take cochlear device implantation code from the index. So if you go to the index page, you will get cochlear device implantation. You will reach the code directly to 69930. With or without mastoidectomy. It's mentioned in the code with or without mastoidectomy. So even though it is with mastoidectomy or without, we need to use this code, same code 69930. This is how you need to check from the index page. So friends, that's all about a few guidelines and some practice questions from 60,000 series. I'll be doing more practice questions. So stay tuned for more videos and more upcoming chapters. So thank you so much for your support. If you have any queries, please mark it in the comments. See you in the next episode. Thank you. Bye.